The Three Faces of Eve. Description of character. The movie The Three Faces of Eve starts off with the character Eve White, a young, beautiful woman in her early 30s. She is a timid and quiet wife and mother of husband Ralph and daughter Bonnie. Eve White is evidently upset and concerned about the recent events in her life, as her relationship with her husband seems to be worsening due to an unknown reason. Eve White and her husband visit a personality therapist, Dr. Luther, who later on in the movie becomes a significant part of this woman's life as he helps her battle her mental illness. Eve White and her illness. The main character in the movie, Eve White, suffers from a specific form of a dissociative disorder, namely dissociative identity disorder, previously known as multiple personality disorder. Although rare, this disorder can range from having a detrimental effect on the individual suffering from it, or it can be mildly present and only emerge in certain situations. Dissociative personality disorder is characterized by the presence of two or more distinct personalities that control the person's behavior and recurrent episodes of amnesia. There is no definitive cause for the emergence of the personalities. Various longitudinal studies have led psychiatrists to believe that dissociative identity disorder is caused by trauma experienced by the individual in their childhood. As is seen later on towards the end of the movie when we find out that the other personalities within Eve White developed from the early age of 6 when she went through an emotional trauma of dealing with her beloved grandmother's death. The sufferer of dissociative identity disorder often loses their sense of self and feels as if their thoughts are being interrupted by an external influence. In order to be diagnosed, the individual needs to have been suffering from symptoms for at least a month marked by the presence of psychotic symptoms. Diagnosing Eve White. Eve White tells her psychiatrist that she has been suffering from severe headaches, which lead to something she refers to as spells. She has lapses in dependable memory, and she has difficulty recalling everyday events from her life and things from the past. In the movie, Eve's husband recovers shoes and dresses seemingly bought by his wife, which he later calls the store and confirms that it was indeed Eve that bought them. When questioned about it, Eve White seems to have no recollection of even visiting the store. A few moments later, we see Eve strangling her daughter with a rope, as her husband arrives just in time to save her. After these incidents, Eve and her husband visit the psychiatrist again, where Eve begs for them to believe that it was not her who tried to hurt her daughter, and that she did not remember any of it. Eve White becomes a regular patient of Dr. Luther, where during one of her visits she experiences a headache and a different personality, who calls herself Eve Black. Eve Black is a reckless, fun-loving, and adventure-seeking person, whereas Eve White possesses none of those qualities. She is shown as the dominant personality as she is aware of Eve White, but Eve White has no clue that she exists. Eve Black loves going dancing and singing and is highly promiscuous. She claims to hate Eve White's husband with a passion. Later on in the movie, another personality called Jane emerges. Jane is a stable and kind young woman who has everything figured out. She becomes the new dominant personality. During the emergence of Eve Black and Jane, Eve White becomes severely depressed as there are changes in her perception and effect due to living 3 completely different lives. Both these symptoms of dissociative amnesia and disruption of identity are evident in Eve White and are enough to get her diagnosed with dissociative identity disorder. Treatment for Eve White. Psychotherapy is the most effective treatment for dissociative identity disorder. Therapists work with patients in the following ways. They improve relationships with the others. They have the patient open up to emotions that they were not comfortable with in the past. And they help multiple personalities coexist with one another and ensure that there is a crisis plan if something unexpected occurs. Hypnosis. Many studies conclude that individuals suffering from dissociative identity disorder are the most hypnotizable of any other group. Helps patients have better control over other personality states when personalities switch. Better control of other personalities results from developing better communication skills between the multiple personalities. Eye movement desensitization and reprocessing. Combines traumatic memories with patients' own resources. Improves information processing and healing for individuals suffering from dissociative identity disorder. Medication. Dissociative identity disorder sufferers often use medication that alleviates many common symptoms attributed by the disease, such as depression and anxiety. However, Sufferers may feel controlled by the medication, which traumatizes them. Eve White versus real-life dissociative identity disorder. The film portrays a somewhat accurate representation of how dissociative identity disorder affects an individual. Obviously, different severities of this disorder would dictate the degree in which the symptoms are present. Eve White's case of dissociative identity disorder presented all the symptoms of the disorder. None of her symptoms fell outside of the realm of the disorder. Many dissociative identity sufferers experience amnesia and memory loss during periods when the other personality is in control, much like Eve. Also, like Eve, many individuals suffering from dissociative identity disorder experience distress in social situations because they either do not recall what occurred or people fail to understand and accept the condition. However, the movie over-dramatizes the changes in personalities to make the movie more interesting. For example, it is common for people to close to the individual suffering from dissociative identity disorder to only notice small changes, if any changes, in behavioral compared to how that person usually acts. But in the case of Eve, drastic changes would occur in a short period of time, greatly exaggerating the changes in behavior that sufferers usually experience. So yes, much of the symptoms the movie portrays is accurate. Much of Eve's behavior is amplified to make the movie more interesting to watch for the average viewer. Sources.